Hi, I'm Andrea. I am going to talk to you today about reducing central line associated bloodstream infections, or what's known as CLABSIs. So the objectives are to recognize 3 facts identified with CLABSIs, recognize 3 out of 5 risk factors identified with CLABSIs, survey suggested evidence-based practice guidelines, verbalize the appropriate approaches to reducing CLABSIs, and exhibit appropriate methods for hand hygiene and how to utilize aseptic technique, distinguish 5 evidence-based facts to prevent CLABSIs. So, as you can see, occurrence, cost, and mortality, there's over 400,000 CLABSIs that occur each year in the United States. CLABSIs result in 84,551 to 203,916 avoidable infections every year. 10,426 to 25,146 were avoidable deaths. Mortality rates within 10 to 20%, $1.7 to $21.4 billion in preventable costs per year, leads to extended hospitalizations, and there's a 46% reduction in CLABSI infections between 2008 and 2013. So risk factors is insertion site. So with the insertion site, you want to pick the subclavian vein because it poses less risk than inserting into the internal jugular or femoral vein. Multiple catheters increases tissue trauma predisposed to CLABSI, more manipulation and contamination to multiple parts or hubs of the catheter. Nurse to patient ratio, an elevated patient to nurse ratio is associated with catheter related bloodstream infections. Secondary infections could be somewhere else like a UTI or an open wound. And IV greater than 72 hours, lines should be removed as soon as possible. And evidence-based practice guidelines, instructions to preparing and staffing. You want to educate healthcare professionals regarding the indications for intravascular catheter use, proper procedures for the insertion and maintenance of intravascular catheters, and appropriate infection control measures to prevent intravascular catheter-related infections. Periodically assess knowledge of and adherence to guidelines for all personnel involved in the insertion and maintenance of intravascular catheters. Designate only 1 trained personnel to demonstrate competencies for the insertion. In adults, you want to use an upper extremity site catheter for insertion. Replace a catheter inserted in a lower extremity site to an upper extremity site as soon as possible. Select catheters based on the intended purpose and duration of use. Known infections and non-infection complications and experience of individual catheter operators. Use a midline catheter or peripheral inserted central catheter instead of a short peripheral catheter when the duration of the IV therapy will exceed 6 days. Evaluate the catheter insertion site daily by palpating through the dressing to discern tenderness and by inspection of a transparent dressing in use. Also, you want to remove peripheral catheters if the patient develops signs of phlebitis. You want to perform hand hygiene by washing your hands thoroughly with soap and water before palpating any of the sites. And you want to maintain aseptic technique for the insertion and care of intravascular catheters. Sterile gloves should be worn for the insertion of arterial, central, and midline catheters. And you want to wear either clean or sterile gloves when changing the dressing on intravascular catheters. Ooh, sorry. So, hand hygiene and aseptic technique is the 2 ways that you can decrease CLABSIs. Then there's the 6 actions to fight germs. So perform hand hygienes by washing your hands with conventional soap and water or with alcohol-based hand rubs. Hand hygiene should be performed during and after palpating catheter insertion sites, as well as before and after inserting, replacing, accessing, repairing, or dressing an intravascular catheter. Palpation of the insertion site should not be performed after the application of antiseptic unless aseptic technique is maintained. And there is a slide for hand washing. So wash hands with soap and water, use waterless hand sanitizer before and after invasive procedures, between patients, after removing gloves, before eating, after using the restroom, and if contaminated is suspected. Disinfect clean skin with an appropriate antiseptic before catheter insertion and during dressing changes. An alcoholic chlorhexidine solution containing a concentration greater than 0.5% is preferred. Maintain aseptic technique for the insertion of the IV catheter. Maximal sterile barrier precautions during the insertion of CVCs substantially reduces the incidence of CLABSI compared with standard precautions. Then there's 5 evidence-based steps to reduce CLABSI: proper hand hygiene, chlorhexidine for skin prep, full barrier precautions during central venous access procedure, avoid using femoral vein in adults unless it is emergent, and remove any unnecessary catheters. Then there's a group discussion. Discuss the advantages and disadvantages of central line catheters versus midline catheters. How will we accomplish reducing the CLABSIs? What do I need to do? How will we know we make a difference? And always ask open-ended questions. In conclusion, central line associated blood infections result in thousands of deaths each year and billions of dollars in added cost to the healthcare system. Even though these infections are preventable, there has been a 46% decrease in CLABSI between 2008 and 2013. There is more that can be done to decrease this even further. Nurses play an important role in preventing CLABSIs. CLABSI rates continue to be a major national initiative. Reducing CLABSIs will benefit the hospital by providing better patient outcomes, reducing mortality, improving satisfaction, and financial benefits. By using evidence-based practice and guideline recommendations, nurses have the tools needed to achieve the best possible outcome for all patients. And